Hi everyone, thanks for joining. We're going to get started now. Just a reminder, 30 minutes, one question, one follow-up. Today we have Dr. Yaffe and Dr. Huyer here, so I'll turn it over to them for some brief remarks.
Thank you. Good afternoon, everyone. For today's update, I will provide a brief overview and comments on our recent numbers, and then I will ask Dr. Huyer to provide his comments with respect to outbreaks. Since we last spoke on Monday, Ontario has recorded an additional 3,876 new cases of COVID-19. The 7-day average is now 1,369 cases, and this is up from 1,299 1 week ago and 996 cases 2 weeks ago. Most of the cases reported over the last few days, in fact, close to 80% of the cases, are concentrated in those regions that are now in the red. Control zone, which is Toronto, Peel, York, Hamilton, and Halton. Our latest test positivity rate for the province is 4.1%, which is only slightly lower than it was 1 week ago at 4.3%. As our cases have increased in recent weeks, so too have our hospitalizations and, unfortunately, the deaths. Today, there are 526 people hospitalized with COVID-19, which is a 22% increase over last week, where we had 431. And there are 146 people in ICU, which represents a 49% increase over last week. Tragically, yesterday we reported 32 people lost their lives to COVID-19, and today we have the sad news of reporting another 28. We do not want to forget that all these numbers represent human beings who have people who love them and care for them. We want to offer our sincere condolences to those impacted by the lives lost and offer our support to those recovering from the illness as well as those caring for them. Before I turn it over to Dr. Huyer, I do just want to add a few observations. We know that these trends are concerning, and overall, we're heading in the wrong direction. We have been saying this repeatedly for some time now. And over the last few days, we have been carefully reviewing the data and discussing next steps for our health unit regions, that feeling of concern and urgency has not diminished. In fact, for some areas, it has intensified. We need to get these numbers down to protect the health and safety of Ontarians and to protect our healthcare system from becoming overwhelmed. I continue to urge people today and every day to make the right decisions. This challenge is not insurmountable, but it is going to be tough. I know what you're saying is we've been asking this of you for quite a while now, and with winter coming, it may feel even more overwhelming knowing that months into this pandemic, we still need to physical distance, wear a mask, only have close contact with those you live with, wash our hands frequently, etc. But those are the things that we know will make a difference, so thank you for doing all you can to help flatten this curve. I'll now ask Dr. Huyer to make a few comments.
Thank you, Dr. Yaffe. And I also want to reiterate the comments of recognition of the tragedy of people who have died over the past months and the loss that families and communities and friends have suffered. And also, as Dr. Yaffe also commented, those who are ill. We listen to the number of people in the intensive care unit. These people are extremely unwell, and it's really important to remember that while we talk about numbers, as said, these are individuals. When we look at outbreaks, remember, are one of the markers of how significant illness is and transmission of this disease, and it represents somewhere between 10-20% within the particular areas, but it's not the sole marker, it's one of them. We have, though, recognized that it is aligned with the spread, and over the past 7 days we've had an increased number of 196 outbreaks reported, which is part of the 676 that have been reported over 30 days. Today, specifically, 26 new outbreaks were reported. Of those, 7 were in the vulnerable sector, which is long-term care homes, retirement homes, hospitals, other congregate care settings. 11 in a combination of schools and daycares. 4 in publicly accessing areas, such as retail, restaurants, sporting, and recreation. And 4 within workplaces or other situations. What we know is that there's many within the areas of high case numbers, but we also have seen them across the province in many different public health units, and we're seeing not only in the vulnerable sector but a broad range of outbreaks. This is certainly highly aligned with community spread, and the spread in the community then comes into the setting, then spreads within the setting, and then the cycle continues, unfortunately, that it goes out into the community and further infection. In areas where there's less, and we have more detailed recognition of the outbreaks, where there isn't as much community spread, the public health units are able to do more detailed investigation, and there is one in a smaller jurisdiction, which was a sporting event that had involvement of 4 different settings, and within those settings there were over 30 cases and over 150 people that were high-risk contacts, and from those 30 there was a spread into a long-term care home and also into households, as well as an allied health professional who could spread to patients. So this allows a greater understanding of the illness, but it also recognizes and points out when it's so widespread, it's really challenging to be able to drill down and fully understand the extent of the outbreaks. What we have seen and we continue to see is it's consistent with social settings. So during social intersections, during settings that may be at parties or gatherings, but also in workplaces when people socialize during their break periods or before and after. People who don't mask during areas of close proximity, and that may be during the exercise in the sporting setting or during their trips to the setting, carpooling, coming together without masks, socializing during and then potentially socializing after. We've recognized that the probability of a person in a setting when there's increased prevalence is higher. And there's information that will show, for example, in a 4% population, if you have a setting of 10 people, there's a 40% chance that somebody will have that infection and then potentially spread it to others. So it speaks again to the importance of remembering how we need to reduce and minimize our contacts to those most essential, and that will allow us to reduce the potential for getting the infection, or in fact, if we had it, transmitting the infection. So very important to think about that, and very important to consider what we can do and how we can all work together to think about where we're going, think about what we're doing, think about how we can reduce the potential chance for any transmission, and then if there is any potential that somebody may have that, take the appropriate steps to prevent any transmission by washing hands, wearing masks, and staying distanced. Thank you, Dr. Yaffe, and we're open for questions at this point, I think.
Mm-hmm. We'll go to the phone lines. Just a reminder, 1 question, 1 follow-up. Over to the first question, please.
Your first question comes from Randy Rath with CHCH-TV. Please go ahead.
Hi, doctors. I'm wondering if you can explain to me why getting close to 150 people in the ICU from COVID is such a milestone, why that is something that people are so worried about.
I'll start. This is something that has been calculated in terms of allowing enough beds in the ICU to continue with elective surgery and other patients who normally come through to the hospital with conditions that require ICU care and treatment. So if it goes over 150 for COVID, then it will impact negatively on people requiring ICU care for other reasons.
Some of the other reasons that we saw a reduction in during the earlier period of time during stage 1 was car crashes reduced, so there was less chance of people being injured and requiring intensive care unit. Surgeries were not occurring, and so there wasn't the need for after the surgery for the people to have that intensive care. So the number is based upon the number of available beds and staffing, importantly, because it's a highly technical and a highly complex care area within the healthcare system. And once that 150 number reaches, I understand, that really limits the potential ability to provide that care for those who need it most urgently, either in the surgical situation or for another situation.
Follow-up?
And didn't we, this is basically a two-part question, didn't we acquire more beds, ICU beds, over the course of COVID? And also, when we have so much community spread that we can't trace, how can the education minister and the premier come out and say that schools are the safest place for our kids to be?
Well, those are two totally separate questions. But with respect to the ICU beds, yes, they are increasing the number of beds. But as Dr. Huyer said, one of the challenges is finding the human resources to staff the ICU beds, because they are extremely specialized in terms of the nurses and physicians and others that need to staff them. And as we have more and more people occupying the beds in ICU, it's those particularly with elective procedures, surgeries, or cardiac procedures that are going to have to wait longer, which is very, very, very a negative impact for other health issues. With respect to the schools, our data has shown, and our experience has shown in Ontario so far, that schools are a relatively safe place for our children, never mind, of course, all the importance around social and educational needs that are being met. But the schools are a reflection of the transmission of COVID-19 in the community. So if we can reduce the transmission in the community, we will have less in the schools. Once it gets in the schools, the measures that are in place have been very effective in reducing transmission within the school. There have been very few outbreaks. Extremely low number of schools have had to be closed. So we have considered schools as a very important priority to maintain open as long as possible and focus on reducing transmission in the community.
And just building on that, Randy, and there are areas that are specifically of high focus for contact tracing that continues in high-risk areas, and schools are very carefully evaluated for the look to see whether there is the potential spread within schools, and understanding as effectively as possible the contacts. And I want to go back to the other question in the intensive care unit. These are people that got sick from something that we hope to prevent. So the ICU is fairly far down the road of illness. These are people who suffered transmission of the virus. They became ill with it, and their illness deteriorated to the point that they are in serious medical condition and require serious medical care. So it's really important that we recognize that we're trying to stop people from getting into hospital, let alone getting into the intensive care unit, because that's fairly significantly down the pathway of this illness, and people are at risk of dying when they're in intensive care unit. So we really want to focus on that and prevent people from getting so ill.
Next question.
Your next question is from Rob Ferguson with the Toronto Star. Please go ahead.
Hello, doctors. Just as since Dr. Huyer was talking about the ICUs, I'd like to stay on that for a minute. It was quite the increase that we saw posted today. 19 in ICU and 10 on ventilators. 10 more on ventilators. That is a lot higher than we usually see. And I wondered if you had any detail behind that as to why the sudden leap, or was that maybe a few days condensed into one? Was it a statistical issue like that?
Hi, Rob. I don't have a specific answer for the particular reason for today. I don't know. What I can say is that we have continued to see progressive increase over the past number of days in many different ICUs. And in my view, and I looked at Dr. Yaffe, but in my view, this is representative of the significance of the number of cases. As you heard from Dr. Yaffe, the numbers continue to increase in cases. And as we have higher numbers of cases, there will be a percentage that will proceed to significant illness, and I believe that's what it is. I stand to be corrected. There may be some other information that I'm not aware of, but I think that that's likely what's going on.
I think agree with that, but I think in addition, the fact is as the community transmission increases and we get more cases, the infection is spreading into older age groups. So it started this time in the second wave with young people, 20 to 39 age group. It's now hitting the older people, it's getting into long-term care, retirement homes, and so on. And we know that people, particularly over the age of 60 or 65, are at higher risk of serious illness and, unfortunately, complications and death. And of course, it also is more serious in people with underlying illnesses. So as more and more people are infected, more older people, it's not unsurprising to see more people ending up in hospital, unfortunately, and in ICU.
Follow-up?
Okay, thank you for those. I'm wondering, since we're all waiting to find out what the lockdown details are going to be tomorrow. When you're deciding on a lockdown now or making recommendations on it, what have you learned from the last time and the latest kind of statistics about what needs to be included and what maybe could be excluded? I remember last time, for example, you couldn't go to the dentist, you couldn't get a haircut. Are some of those things going to be possible, do you think, given the data you've got? Do you have a lot of evidence of transmission at the dentist or in barbershops or, things like that?
I am not personally on the public health measures team, so I'm not aware of the details of what they've recommended, other than I do understand that schools are a high priority not to be closed as much as possible. Obviously, we'll have to see. The recommendations from public health measures have gone to the Chief Medical Officer of Health, Dr. Williams, who then brings them to the Minister of Health, and then they go to Cabinet. So unfortunately, I don't have any further details, so we'll have to wait and see what comes out.
Next question.
Your next question comes from Jeff Gray with the Globe and Mail. Please go ahead.
Hi, thanks. I wanted to ask just if there's any update on how health units, particularly the ones that were in trouble, are doing on contact tracing. We heard a lot about more staff being brought in and more effort being made there. Is there any hope on the horizon that contact tracing is getting back to closer to the metrics that have been set out?
You're right. It has been a challenge particularly for those health units who have had large numbers of cases. And I know that Toronto Public Health, for example, had priorized a follow-up. They investigate all the cases. They determine if the individual had any exposure in a congregate setting, long-term care, school, etc. And those are the priority cases that get contact follow-up, although they inform the case to talk to their household or other close contacts. I understand they are going to be going to further contact follow-up using technology, I believe. And this is something that actually the province has offered to all the health units now, to use what we call the virtual assistant, where it works for the case to then the health unit will send an email or some kind of message to the contacts or to the case to fill in the contact information that can then be followed up by third-party call center staff. So we do have a significant number of staff trained to do that kind of third-party contact follow-up. We're also now working on bringing in a team of staff who can do more case investigation. That's a little more difficult. It takes a little more training and experience. Because even that is difficult for the health units to get to the hundreds of cases some of them are getting each day. So we're very actively working on increasing the capacity of the health units to do this work.
And I think this speaks to the three things that Dr. Yaffe's taught me about, of the important things to evaluate when we're making decisions, generally everybody, but also from a province and a health unit perspective, is the transmission that's occurring, the public health unit capacity, and the healthcare capacity. And this speaks to, your question exactly speaks to the challenge that occurs with multiple contacts, multiple cases, and the challenges that are observed with the investigations. And everybody is working together to try try to ensure that contacts are notified and that cases that we understand the best way possible. But when there's such significant spread, everybody should be taking increased precautions, even more so because of the prevalence within the community. Want to make sure that they're all taking steps to ensure that there's awareness of that risk and protection from that potential for transmission.
Actually, I forgot to mention as well, encouraging everybody to download the COVID app on your iPhone or your phone if you can, because then if as a case is informed, they can ensure that contacts are notified anonymously and can get followed up. So that is a very good tool that we should be using as much as possible. And as Dr. Huyer said, it's important to remember that anybody that you are interacting with could have asymptomatic COVID, could not know that they're infectious. So that's why we're saying, unless you're with the people you live with, otherwise, try not to interact with people closely if you don't have to. And if you do, please wear a mask, wash your hands, don't go out if you're sick. Those are the basics that we have to keep remembering to keep this infection from spreading further.
Follow-up?
Well, and actually just connected to that, I guess, is the advice that has been coming now, which is moved from that it's maybe safe to go to someone's backyard and be 2 meters away from them, or have a mask and be 2 meters away from them, to not do that at all, at least in the red zones. Is there any movement on, is that advice that we've heard throughout, that 2 meters away with masks is a pretty good couple layers of Swiss cheese, as the saying goes, or is there some evidence that 2 meters is not enough, that this thing travels further than we think?
Generally, 2 meters is sufficient in terms of the transmission. The majority of transmission is by large droplets. So if I were infected and I'm speaking loudly or shouting, which of course I would never do, except for my children. Anyway, if I'm singing, if I'm coughing or sneezing, the large droplets that are produced tend to drop within 2 meters. So if I'm 2 meters away from you, you won't be exposed to those. The exception is, and what we have found is, if you are you're in a small, crowded place with close contact, poor ventilation, there may be very small particles that I'm producing that could travel further in the air. So that is the circumstance we try to avoid. We don't want to be inside with poor ventilation in a crowd. And we obviously should be wearing a mask. And that's why it's one of the many things we talk about is the importance of having a good ventilation system. Keep the windows open if you can. Obviously, it'll get cold. That will be difficult. Make sure that the building you're in, that the HVAC system, heating and ventilation, air conditioning system, has been maintained and is up to date. So that's another thing people should keep in mind.
And so important, your question speaks to what people should be doing, in our view, I believe, is thinking about where you're going, thinking about what you're doing, thinking about the potentials of what Dr. Yaffe just talked about. So everybody should be thinking about this. It's a whole different approach to many things that we've done in our lives. It's frustrating. It's sometimes very daunting, sometimes very tiring, but we'll work together. We'll continue to do this, and we'll continue to stop the spread and then reduce the chance for people being ill.
Next question.
Your next question comes from Wendy Gray with Vista Radio. Please go ahead.
Thank you very much. Dr. Yaffe, I don't know if you'll be able to answer a specific question like this, but we just had a press briefing with our medical officer of health in Huron-Perth, and she says she has recommended that we move from yellow into orange. Is that something that the province will consider?
The province looks at the data for each health unit twice a week, I believe, and has conversations with each of the medical officers of health where there's a change being recommended based on the data. The local medical officer of health has their experience locally. Do they agree that, yes, this is a problem, it should be going up or down? and also what are the local businesses and local officials feeling about this? Is this something that would be workable? And so if that medical officer of health has spoken to our staff and the chief medical officer of health about that recommendation, if everybody feels that's the right recommendation, that's what would happen. So I don't know the specifics about here on Perth, but if that MOH, medical officer of health, has talked about that publicly, the chances are that's probably what's going to happen.
Follow up?
And when would that decision be made?
I believe they're going to be announced shortly, possibly tomorrow, but I'm not 100% sure.
Last question.
Your final question comes from Colin DeMello with CTV News. Please go ahead.
Hi, good afternoon, doctors. As we come up to the Christmas season, I just wanted to know how much of a concern is indoor retail, especially things like malls.
Hi, Colin. It's Dirk. How are you doing? I think that it's one of the many things that we all need to think about. I don't have a specific answer for you. These are all considerations that will be made by the Public Health Measures Table, but I think the important thing is to come back to the first principles that have been talked about many times today, and I hate to be repetitive on them, so I'm not going to be, except for ensuring that people aren't in close proximity and that the appropriate precautions are taken so that there would be reducing all avenues of potential transmission. So I think it fits with other areas of concern. I don't have a specific comment about malls, except if you think about what was done in a modified stage 2 before, not to say this is the way it would go, but just an example where the dining areas and the eating areas were not left open because of the close proximity. It's not so much about the eating, but it's the close proximity, the people without masks and gathering together. So I think it all goes back to thinking about how would you approach this from a broader perspective of transmissibility and risk of that.
And also considering what zone your health unit is in. If you're in a red zone, obviously there's more concern with going into a mall. You might want to consider online shopping or shopping at off hours, obviously using all the precautions. Whereas if you're in a green zone, it may not be as much of a concern. Obviously, you would still use all the same precautions, though.
Follow up, and this is the last question.
Thank you. Yes, I mean, I understand that you guys might not be aware of what the Public Health Measures Table has necessarily recommended and don't necessarily want to speak on behalf of them. But I'm just wondering, so when you're talking about those crowded spaces, especially when we're coming up to the Christmas season, is that something that ideally you would like to see or the province would like to see clamped down, especially because around the Christmas season you might see a hustle and a bustle at any particular mall, and some malls tend to have thousands of people in them at a time. Is that something that the province is comfortable with, like capacity limits inside of a store, but allowing the malls, the hallways of the malls to still have enough people in them? Is that, like, where do you draw that line?
I think, Colin, you're illustrating exactly the types of things that need to be thought about. And neither Dr. Yaffe or I are on the Public Health Measures Table, not to avoid this question, but we simply don't know the discussions that are occurring at the table. And this is the type of thing that they are evaluating and Dr. Williams is evaluating. And then advice will be drawn from that. But not to avoid that, but to answer the particular question, I think you are exactly illustrating the shared responsibility that occurs with all of these decisions. So do you go, as Dr. Yaffe said, in the green zone? Do you go? You can. You take your steps. You take your precautions. You wouldn't go when it's as busy as another time. So you make you do thoughtful consideration of when you go. The malls would have a role, I would suspect. The individual retailers would have a role. So everybody, and then individuals intersecting with other people would have those responsibility to think about how to reduce transmission. So turning it back to you, I think it's a great question that you're asking, and one that all of us need to be challenged with on our day-to-day activities. And where the province or the Public Health Measures Table, that will be another contribution to that overall consideration.